Washington state legalized medical cannabis in 1998. Recreational stores are not required to be endorsed for medical sales. An endorsed store must have medical cannabis consultants on staff, have DOH-approved product available for sale, and must be able to enter qualified patients in the medical cannabis registry. 420-friendly has been endorsed since 2016. There are 12 qualifying conditions that have been identified by the state of Washington where patients may benefit from the medical use of cannabis products. Hepatitis C is a viral infection that primarily affects the liver. It is caused by the hepatitis C virus. The infection causes inflammation of the liver, which may lead to serious liver damage. The virus spreads through contact with blood that has the virus in it. Hepatitis C is a qualifying condition for obtaining a medical cannabis authorization in Washington state. This allows patients to legally possess and purchase cannabis for medical use, including for managing symptoms related to hepatitis C and its treatment. The Washington DOH oversees a voluntary medical cannabis registry. Patients can get a medical cannabis card from a medically endorsed retail store after receiving a qualifying authorization from a healthcare provider. Registration offers benefits such as excise and sales tax exemption on medical compliant products. A link to our video on how the database works and what you need to know about the benefits of having an authorization will be featured at the end of this video, or you can find it under the playlist Medical Cannabis. The program allows a qualifying patient to name a designated provider to purchase and/or grow cannabis on their behalf. Designated providers must also be registered and hold a recognition card. While cannabis can't cure hepatitis C, it may help manage symptoms like nausea and poor appetite, potentially helping patients adhere to their prescribed treatment plan. However, research on cannabis and liver disease is complex and sometimes conflicting, with some studies suggesting potential risks for liver health. It is crucial to consult your healthcare provider to discuss the potential benefits and risks of using cannabis for your hepatitis C symptoms and to ensure it doesn't interfere with your prescribed treatment. There are potential risks and concerns including conflicting liver health data. While some studies suggest cannabis may have anti-inflammatory or antifibrotic effects on the liver, others indicate potential risks. Impact on steatosis. Some research points to CB1 receptor activation in the liver being prosteatogenic, promoting fat accumulation, and potentially worsening fatty liver disease. Other risks. The long-term effects of cannabis use in individuals with hepatitis C are not fully understood, and it is crucial to avoid alcohol, which is known to worsen liver inflammation and fibrosis. It is crucial for patients to have an open, non-judgmental conversation with their care team about cannabis use. This ensures they are aware of potential drug interactions and safety concerns. Because state and federal laws on cannabis differ, it is important to understand the regulations in your location. Specific terpenes being investigated for potential benefits in managing hepatitis C, HCV, include beta-caryophyllene, limonene, linalool, myrcene, and saponine. Limonene. Found in citrus peels, limonene has demonstrated antioxidant and anti-inflammatory properties that may help protect the liver. Animal studies suggest it can reduce markers of liver damage and protect against toxins. Its ability to reduce oxidative stress and inhibit pro-inflammatory factors, such as IL-6 and TNF-alpha, could offer a hepatoprotective effect. Examples of strains high in limonene include Kush, Jack Herer, Super Lemon Haze, Cinex, and Wedding Cake. Beta-caryophyllene. This terpene has been shown to reduce liver inflammation in animal studies. It acts as a selective agonist of the CB2 receptor, which is known to help suppress inflammation and modulate immune responses. Research also suggests it can protect liver cells from oxidative stress and potentially slow the growth of hepatocellular carcinoma, HCC, a common complication of advanced HCV. Examples of strains high in beta-caryophyllene include Bubba Kush, Sour Diesel, Gelato, Chemdog, Death Star, and GG4. Linalool. In preclinical studies on mice with liver injury, linalool was found to have a protective effect by reducing inflammatory responses and supporting the liver's antioxidant defenses. It inhibits the NF-kappa B pathway, which is heavily involved in inflammation, and activates the NRF2 pathway, which boosts antioxidant activity. With a floral aroma, linalool is found in lavender and mint, in addition to some cannabis varieties. It offers calming, anti-inflammatory, and analgesic properties, which may help ease abdominal pain and reduce inflammation in the digestive tract. Examples of strains high in linalool include Do-Si-Do's, Lavender, Skittles, Grand-Daddy Purple, and Amnesia Haze. Myrcene. This terpene has strong anti-inflammatory properties and has shown promise in protecting the liver from injury by reducing both inflammation and oxidative stress. Myrcene works by intercepting inflammatory signals at their source. Examples of strains high in myrcene include Blue Dream, Grand-Daddy Purple, Grape Ape, White Widow, and Tangy. Sabanine. Studies in rats with liver injury show that sabanine significantly reduces inflammation and oxidative stress. It helps to protect liver cells by increasing antioxidant enzymes and modulating inflammatory cytokines like TNF-alpha and IL-6. Examples of strains high in sabanine include Super Lemon Haze, Super Silver Haze, Diesel, and OG Kush. Cannabidiol, CBD. A non-psychoactive cannabinoid, shows promise in managing HCV-related issues and may have direct antiviral effects. Potential benefits. Antiviral activity. A 2017 in vitro study found that CBD significantly inhibited the replication of the hepatitis C virus. Researchers are investigating if these results translate to effective human treatments, possibly in combination with standard antiviral drugs. Reduced inflammation. CBD has strong anti-inflammatory properties, which could help protect the liver from the damage caused by chronic inflammation from HCV. Antifibrotic properties. CBD has been shown to reduce liver fibrosis, scarring, at a cellular level by inducing apoptosis, cell death, in the hepatic stellate cells that cause scarring. Pain and anxiety relief. CBD can help alleviate pain, anxiety, and depression that often accompany chronic conditions like HCV. Tetrahydrocannabinol, THC. The psychoactive cannabinoid in cannabis can help manage symptoms but carries greater risks for those with liver disease. Potential benefits. Symptom management. THC is known to alleviate pain, nausea, and vomiting, and to stimulate appetite. For patients undergoing older interferon-based therapies, THC improved treatment adherence by controlling side effects like nausea and appetite loss. Inflammation reduction. Like CBD, THC has anti-inflammatory properties and can help with liver-related pain. Potential risks. The liver metabolizes THC, and for patients with advanced liver disease or impaired liver function, this can lead to a prolonged high or other adverse effects. Heavy, daily cannabis smoking was also linked to faster fibrosis progression in some older studies, though more recent evidence is mixed. More research, including human trials, is needed to fully understand the endocannabinoid system, phytocannabinoids, terpenes and flavonoids, their effects, benefits, and optimal usage. How they all work together and in what combinations. While progress is being made, it is important to always consult your doctor before using cannabis to treat any medical conditions, as it may interact with other drugs, particularly those affecting the central nervous system or metabolized by the liver. It is known that certain cannabinoids may enhance the effects of blood thinners and sedatives, and it could potentially alter the effectiveness of antidepressants and immune modulators. Thank you for joining us. We hope this information has been helpful and that you'll join us as we continue to explore the potential benefits of this amazing plant. Please hit that like and subscribe button and leave us a comment and let us know if there are any other topics you'd like us to cover. Until next time. Peace.